Thanks, Eloise. Hi, everybody. It's great that you could join us today. So today I'm going to be talking about nutrition measurement tools. So I'm just going to share my slides. So nutrition and measurement in general is obviously really key outputs to any sort of interventions that you might be delivering if you're involved with public health within the city. And it's really important to measure the impact and outcome measurements in any intervention. And the reason is because this obviously helps us demonstrate that what we're doing is making a difference. And we can do this through stories as well, but we also want to make sure that we have measurable impact. So using standard tools, it helps us to compare different interventions' impact. We can also find out if different interventions are more effective for different groups. And we can do this by comparing the standard measures, these measurement tools that we have, with also combining that with standard questions on people's identity. And then we can work out if some interventions work better for some people than others, and so on. We can also measure the cost effectiveness of interventions because we can look at the impact that the intervention had, the number of users who participated, and then the cost of the intervention too. So there's lots of different ways that these impact measures can support. But without having clear impact and outcome measurements, it's really difficult to support funding for interventions and to justify that the approach used should be continued or scaled up. So this is something that's important at every scale of intervention because this is what enables us to continue and build on a good practice within the city. So the Birmingham Public Health Measurement Toolbox has been developed to standardise the impact and outcome measures for interventions that are trying to improve health and wellbeing across Birmingham. So this toolbox is designed to support organisations as they're developing projects, and it helps you to build appropriate measures into your service design. And it aims to provide clarity and transparency on how to clearly assess and measure interventions based on their focus, which can be then clearly demonstrated within applications for funding. And it also allows for accurate and meaningful comparisons between different programmes and interventions, which helps inform decision making as we go forwards. So there's quite a few different areas of resources within the toolbox. So there's physical activity, smoking, mental well-being, high blood pressure, hypertension, long-acting reversible contraception, HIV and hepatitis risk reduction. Within the nutrition element of the toolbox, what we're discussing today is what is nutrition, the national and local context of nutrition, measuring nutrition and different outcome measures, the decision-making process when collecting data and evaluating a project, example measurement tools, and how to use the tools and to evaluate the project process, risks and issues to consider, and how to report findings. And I'm also going to give an example of how this can be used in practice. So first of all, what is nutrition? I know there's going to be people on the call today who already are quite aware of this, but we want to make sure that we start with a ground knowledge for everybody. So if I am telling you things you already know, then I do apologise. But nutrition is all about how we provide the body with nutrients it needs for growth and good health. And it can be described as how we nourish our bodies via the food and drinks that we consume. And eating a healthy and balanced diet is absolutely vital for our bodies to work at their best and to have the best chance at fighting disease. On a national level, the Diet and Nutrition Survey is used to collect data on what people in the UK eat and drink. And through that, it's been found that we eat more fat, salt and sugar than the government recommendations. So as a nation, we do. We also eat a lot less fibre, fruit and vegetables and oily fish than the government recommends. And in England, around 2/3 of adults are above a healthy weight, and 1 in 3 children leaving primary school are also overweight or living with obesity. On a local level, the proportion of Birmingham eating the recommended 5 a day fruits and vegetables is also lower than the England average, so even poorer than the level across the nation. The percentage of adults who are overweight or obese is also higher than the England average at 63.5%. And also food insecurity disproportionately affects the most vulnerable groups in our city. And there's too many citizens having to make difficult choices between buying healthy food or paying bills. And that puts a huge strain on nutrition too. So with measuring nutrition, there really isn't a one size fits all approach. There's lots of different outcome measures that you can consider. And so there's lots of different tools that you can look at. So with overweight and obesity, the standard measurement tool that people often use is BMI. With consumption of specific foods and nutrients, such as fruits and vegetables and food high in fat, salt and sugar, there's also tools that you can use to explore that. There's overall dietary intake, so food frequency questionnaires and dietary recalls, so people remembering what they've eaten in the past 24 hours, for example. There's also food literacy, so the ability to understand and make informed decisions about food, including the knowledge of nutrition, cooking skills, and the social environment and environmental impact of food choices. And also food insecurity. So this term is what's used to describe when someone is unable to access or afford nutritious and safe food, which is also socially and culturally acceptable in order to live a happy and healthy active life. So in terms of decision-making processes, when you're trying to work out which tools are most appropriate for you, the first thing that you need to do with your intervention or project is clearly define your objectives. Like, what is it you're aiming to achieve? What do you want the result of your project to be? For example, this could be increasing fruit and vegetable consumption, or it could be improving individuals' cooking skills. Once you know what it is you're trying to achieve, it helps you select your outcome measure. So you need to choose the outcome measure that's relevant to what it is that you're trying to achieve. So examples could be consumption of specific foods, so fruits and vegetables, or it could be level of food literacy, other things that you want to measure. Once you know what you want to measure, then you can explore what measurement tools you can use. So it's important to select the correct method for your outcome. So for looking at consumption of particular types of foods, a food frequency questionnaire might be useful, or a dietary screener. And there's also some food literacy tools too. Finally, you need to collect the data. So these measurement tools, it's really important to collect the data both before and after your project or intervention. This is so that you can measure the change over time. So make sure you measure not just at the end, but make sure you measure at the start too, so you've got a comparison. So one of the measures that you can explore is measuring overweight and obesity. So BMI is body mass index, and it's a measure that works out whether your weight is healthy or not using your weight and your height. So the calculation, it divides an adult's weight in kilograms by their height in meters squared. But you'll be glad to know that there's a very handy toolkit on the NHS website, so you don't have to work all this out yourself. It's important to note that it's the way that the BMI is measured is different for children and young people, and it also takes into account age. And if you follow this link to the NHS BMI calculator, it also accounts for ethnicities and what's a healthy weight for different people in our communities. So if you are looking at measuring BMI on your project, I'd highly recommend using the NHS BMI calculator. And as I said, using it before and at the end of the project. And we'll talk about a few things later, but it's really important to note it's absolutely crucial not to stigmatize weight. So the ways we go about measuring weight is really important, and we'll discuss some ways and some links that you can explore to see how you can do that in a way that is supporting people in your project as well. But the barriers, no, the sections within the BMI, you can be classed as underweight, healthy weight, overweight, or obese, depending on which score within the BMI the calculation comes up with. So yeah, this one would be appropriate for projects that are trying to tackle overweight and obesity, but it's important to note that the impact on overweight and obesity it often needs much longer term projects and holistic lifestyle change on a large scale. So you could have a project that transforms eating habits and doesn't have an impact on overweight and obesity because it hasn't been around long enough. So it's important to recognise that measuring BMI isn't something that ever should be done alone, and also that there's lots of other things can impact on BMI, because your intervention won't be the only place that someone's interacting with food and with physical activity. So make sure you have other measures too, but it's certainly a very strong measurement to have as part of a suite of measures that you have. Another thing that you might want to capture is fruit and vegetable intake. So diets high in fruits and vegetables are associated with positive health outcomes. So it's a really positive thing to try and achieve, especially because locally and nationally we are not eating enough fruits and vegetables. There's quite a lot of dietary screeners out there that you can use to get basic information about a few different foods or drinks over a period of time. And I've put a link here to the 5-a-day community evaluation tool, the FACET tool. And it's a self-completion questionnaire that focuses on intake of fruit and vegetables. And you can see on the right-hand side of the screen that it asks, have you eaten any of the following foods in the last 24 hours? And you can put that you've had 0, 1, 2, 3, or 4 plus portions of that food. So often it's good to explore things beyond just fruits and vegetables, because you can see dietary change in a broader way if you consider things like cereal, whether you had fruit for breakfast, if you had it for a snack between meals. And there's also other types of foods that also contain vegetables. So, for example, soups and dishes that have vegetables integrated in it. So having a questionnaire like this, which describes different types of ways that people might consume fruit and vegetables, can be a useful way of really working out exactly how many portions people have had. With food literacy, this is the ability to understand and make informed decisions about food, including knowledge of nutrition, cooking skills, and the social environmental impacts of food choices. So I put a link here to the Oz Harvest's 6-week NEST, so Nutrition, Education and Skills Training Programme, because they produced a pre and post survey which included questions to measure food literacy, confidence, self-efficacy, which is how much people feel confident that they're able to do something, and they feel empowered to be able to make those decisions, and also food behaviours. So the questions include assessing and understanding food labels and basic nutrition knowledge. And these questions are can be a good basis for assessing the success of a project if its aim was to improve food literacy. So the example on the page here is a nutrition panel. So it can, the first question is asking what is the main ingredient of the product, and then they can look to the bottom of the label to see if they can interpret which of these is there in the biggest quantity. So the first ingredient is the one that there's the most of, so it will be cereals. But that's the sort of thing that you could be exploring within a food literacy project, and by the end you'd hope that they'd be able to interpret that within the label. There's also questions about whether there's more sugar or rice in the product, and how to interpret the per serving and per 100 grams measures of how many grams of sugar are in there. So as I said, this is just a nice standardized way to explore whether somebody does understand food labeling and other measures around food literacy too. Another really important concept is food insecurity. So this food insecurity experience scale, the FIES, it consists of 8 questions about people's access to food. And what's really important about food insecurity is that we want to not only capture how many people experience food insecurity across the city, but also how severe it is, because there's different levels of severity. And the questions here are things like, uh, how many times have you been worried that you would not have enough food to eat, that you only ate a few kinds of foods, that you were unable to eat a healthy and nutritious food, you ate less than you thought you should, you had to skip a meal, your household ran out of food, you were hungry but did not eat, and you went without eating for a whole day. And if you follow the link through to the food insecurity experience scale, there's instructions about how you can use this tool and how you can do it sensitively to make sure you can capture not just the frequency of food insecurity, but also the severity of it. But this tool, it's only 8 questions, and it's quite a quick one to use, and it's quite a useful one to integrate into programs. When you go about using tools, it's really important to make sure that you have participants' consent before collecting any data at all. So they have to be aware of what you're doing and why, and being really transparent about the purpose. And the other thing that's really key is letting people know why you're asking the questions you're using and why you're using the tools you are, because it can be that If somebody doesn't understand why you're asking, they don't bother filling it out. So having really open communication and ensuring that people understand that the reason you're measuring impact is not to have any judgment on them, but to see how effective your program was and to be able to give feedback to the people who have funded the program too. So I find open communication with participants is really important, as well as ensuring that you've got their consent to collect any data. When it comes to measuring BMI and also other food related measures, and height and weight, they can be very sensitive issues to discuss. Individuals might feel more comfortable self-reporting this information rather than having it measured for them. I think sometimes it's about how it's recorded and how publicly. So if you can do it in a way that's subtle, you can say that there'll be a private room and there'll be somebody who they feel comfortable with doing the measurements, but really consider how to make sure that it's in a private setting and that they're comfortable, and that you consider different ways to go about capturing this measure in a way that's really supporting individuals. There's some great resources about weight stigma on the link that I've included there. It's really important that we stop stigmatizing people around weight. You can be technically a healthy weight and have a poor diet, or you can be technically overweight and have a fantastic diet. So associating stigma and judging people on their weight is something we really need to avoid. And it's really important to think about what language we use. So I'd highly recommend looking at the weight stigma resource that's attached. It's also key to consider what's the best way to deliver the tool. Like, is it an online tool that somebody can complete a questionnaire online the best way, or do they require paper formats? It's important to consider whether people have access to phones, to laptops, or to the internet or electricity to charge their phones in order to be able to complete them. You've got to consider literacy levels and whether people understand what the tool's asking them and whether the tool's easy enough to use. So this comes along to the next point, which is test your tool with someone from your target group beforehand and consider if the questions are easy to understand, and consider also whether someone might need some additional support with completing it, and whether you can provide support for people on your intervention to with answering the questions. And again, make sure to take the measures before and after the project or intervention so you can compare them when reporting your findings. So you want to know what the measures were at the start of the project and what the measures were as a result of the project. And not just that, but if you can do follow-up measures a few months later and see if the impact continued, that's really important too. Another thing that's really important to consider is measuring the process. So you can deliver an intervention that should have worked really well, but then there were issues with the delivery that meant it wasn't effective. So by capturing the process and how well it was delivered and how people experienced the project, you can see whether it was the intervention that was the issue or whether there were some barriers. For example, if there was a power cut and you didn't manage to deliver the project properly, you need to be able to capture these sorts of insights in order to interpret your results accurately. So as you're going along, you can note down what's gone well, what things could be improved if you were to do the project again. And that self-reflection is really good for future projects, but also if you're planning to do a few different sessions within your intervention, it can be something that you can work on improving the delivery each time. Some of the questions you might want to consider are, were the objectives of the projects met? If so, how? And if not, then why? Were there any challenges or barriers to implementing the project? Have any adjustments or modifications been made as the project's progressed? This might be because you recognise that people weren't engaging with the delivery model and you had to adapt it to make it easier for people to engage, or there might be other reasons too. What feedback have participants provided about their experience? And also, is the change maintained over time? So is weight loss maintained several months after the project? So it could be 3 months, for example. And is there anything you can do to help maintain the impact of your project in the long term? There's also some specific risks and issues that you need to consider. So it's really important to define your objectives and select the right tool before you begin to work, because If you are measuring BMI, but you're actually doing a project about health literacy, then it might make it seem like your project wasn't successful because you didn't impact on BMI. But actually, if you used one of the health literacy tools, that would have captured the impact of what you were delivering. So think really hard as you're planning your project. What is it you're trying to achieve? What outcomes do you hope to see? And then define what tool would be the best one to help you assess that. Also consider that the tools that you use might have to be adapted based on the group you are working with. So it could be children or adults or different languages, different ways people engage. And there's a lot of tools available, and I'll share a link where you can find out even more. There's lots of tools available out there, but you should always validate them, make sure they work with the group that you're working with too. It's very rare that you get a tool that can just be picked up off a shelf and delivered straight away. You have to think about how to adapt it to your intervention and the people that who are using the service or intervention. Also, people often don't answer all the questions when a survey takes a long time to complete. So it's important to make sure that you make the questions count that you're using. If the survey's really long, they might just not, they either won't complete it, or they'll miss sections, or they won't put as much effort into it. So think carefully about what questions you definitely want to capture, and what ones you could capture in other ways. For example, you could do focus groups or interviews and capture feedback in other ways if it doesn't have to be on the questionnaire. But just consider that people may not complete them, so think about what will make it easiest to get as much feedback from people as possible, and the most important outcome measures are being measured. So how to report the findings. So within your report, there'll be other guidance linked to the toolkit as well, but it's important to introduce the project that took place, give information about who your target population of the intervention was, and then also give information about the number of people who did actually participate and their demographics. So that can be things like age and ethnicity, and whether this matched your target population or not. So you can reflect on whether you actually managed to engage with the people you were trying to or not. And that's an important thing to consider and reflect on in your report, because it can also impact on how effective your intervention is. So by capturing that, it's something that you can reflect on. Make sure you anonymise the data. You have to make sure that no participants are able to be identified within the project and within the project write-up. So make sure there's no names, addresses, try to make it as general as possible. If you use demographic data, so somebody of an age bracket what tended to have this the intervention had this impact on them, that sort of thing's okay. But if you start specifically saying a particular 46-year-old said this, then that becomes too identifiable. Somebody might be able to work out who that was, and then we're not being anonymous anymore. So consider how you can report your findings to make sure that it is anonymous. Describe the data that you collected before the project started, so that's called a baseline. So and you can also report on things like, if you were measuring BMI, you can say the number of people who were in each BMI category. You can attach a code to different people within the intervention if you want to measure them before and after, and still be able to measure the impact on them as an individual, but you can do that in an anonymous way. So sometimes somebody creates a code with numbers and letters, and that's attached to that person. And then when they do the follow-up measurements, you can use the same code again, and you can track whether that individual had a change in outcome measures or not. Describe the data that you collected after the project was completed. So this should be match the information that you collected at the start, but then you might also have additional process measures that you capture too. Highlight any changes that you found in the data. Did things did you achieve the outcomes that you were aiming for? Did things stay the same, or did it actually get worse? Any insights into the changes is important. And report any findings for each group of interest. So it might be that you wanted to separate out people who were below the age of 25 had this effect, and people who were older had that effect. If you notice that there's particular groupings around demographics that are useful to compare, so it could be different ages, it could be ethnicity, or it could be other demographics. And I know there's some other measurement toolkit support around those sorts of measures too. It's important to note that in the case of small sample sizes, we must use a small number suppression approach. This basically means that if there's a small enough number, we need to make sure it stays confidential. So if there's only 1 or 2 respondents who gave an answer, just report it as less than 5 in the reports. So rather than saying one person said this or 2 people said this, which could end up being identifiable, you can just say less than 5 had this outcome. And this means that you're not going to be reporting identifiable information about particular people. It's also really important to acknowledge that small numbers are a limitation to being able to make strong conclusions from your findings. So if you've got a project with 1,000 people and 300 people said had a particular outcome, you might be able to say that's a trend. But if you've got a project with only 10, you have to recognise the limitation that it's only related to your own project itself. So take the sample size and the numbers of people participating into consideration when you're interpreting the data. And also reflect on the learnings from the project and data collection process and from your process evaluation, and put that in the report as well, because as I said earlier, that can really help with interpreting what worked well and what things we can all learn from. So I'm just going to share a brief case study about how one particular intervention went about approaching their measurements. So this was a school and family-based healthy lifestyle programme. It was a 12-month programme and it encouraged healthy eating and physical activity. It included a daily 30-minute physical activity opportunity. They had 6-week interactive football skill programme, signposting to local physical activity opportunities every 6 months, and they also had a termly school-led family workshop on healthy cooking skills. They defined their target population groups. They were aiming it just at year 2 within the schools, so that's 6 and 7-year-olds. And they defined that it would be in a 30-mile radius from around where the project was taking place. So they said schools within that 30-mile radius were eligible to take part. So it could be within your project, you define a geographical area, we have a population group that you're aiming at. The project had identified 200 schools and then approached them in turn. So not all at once, they approached them in turn until they recruited 54 schools. So that's the number they were aiming for. They realised that they needed a long list and their aim was to get 54 schools to participate. They actually had to approach 143 schools to get to the 54 saying yes. So when you're recruiting individuals or people, take into account that you might have to have 4 times as many people in mind, with the idea that just a quarter might participate in the intervention. So keep that in mind, that always aim for larger, because not everybody will be able to participate. And even once the project started, they planned for 20% of people dropping out once the intervention began. So sometimes this can happen because of personal circumstances and many other things that are outside of your control. So make sure that you recruit enough people that if 20% of people drop out, you can still deliver the intervention. And just plan for that eventuality happening. Like, don't allow that type of situation to stop you from maintaining your momentum, because it's something that happens in all projects. They also had control schools, so that means they had another set of schools that had no intervention taking place, and they still did the same measures there. And what it meant they were able to do was to compare the results from where their intervention was taking place to schools that just had the normal practice. That's not always possible on a small scale, but it's something to consider, that if you can look at comparing how impactful your intervention was in one group compared to another, it really helps interpret the information. If you are doing those types of approaches where you've got control participants and intervention participants, then make sure that they're matched on as many factors as possible. You try to make sure that they've come from the same sort of geographic areas, that they've got the same sorts of demographics, because if they're not similar groups, then they're not comparable. So try and control for as many different variables as you can. Then you know whether the intervention itself was what had the effect or not. They collected data on the number of schools that participated, the number of children. They looked at free school meal uptake, because the level of deprivation would have a huge impact on the school and outcomes there. They also captured information about ethnicity and school size. And the primary outcome measure that they were looking for was obesity. That's the main thing they wanted to impact. So they measured BMI at baseline, so at the very start of the project. Then the project went on for 12 months and they measured BMI at follow-up at 15 months. And then they did another measure at 30 months after the start of the project. Then they did an additional follow-up BMI measurements with a small group at 39 months to see if there was any long-term impact. So they've got several time points there. So if your project was maybe 4 weeks long, you might choose to have measurements at baseline before you started. You might decide to have them at the end of the project at 4 weeks, but then you might want to do a follow-up at 3 months and maybe even 9 months or further afield, depending on what it is you're trying to measure and what's within the scope of your project. But certainly having multiple measurement points is really powerful for seeing what the immediate impact of the project was and what the longer term impact is. Within this particular project, they also had secondary outcome measures. So they did waist measurements, skin folds, body fat percentage, blood pressure, dietary, physical activity, and psychological measurements. And they measured these at baseline, 15 months and 30 months. With these, it's really important to measure that some of them you have to be trained up to be able to deliver. So if it's something that you want to consider, maybe look into how you can integrate that into your project to make sure it's done in a way that's accurate and also is delivered in a way that supports the participants in the project and is done in a way that reduces stigma and is just well thought out. So sometimes you can have a look into the different types of projects that you want to do and the sorts of measurements that you want to have and see what's viable for you. It might be that you decide that some of them, like measuring skin folds, for example, like, oh, that's not something we're able to do. But you could put in your notes, in your evaluation report, the reason why you decided not to do certain measurements. So at least then you're demonstrating why you chose what you did in terms of measurement tools and why you chose that some of them weren't appropriate. The additional measures and process evaluation that they did were delivered through questionnaires for school staff and parents. They also had interviews with teachers and they also did focus groups with parents and children and teacher logbooks to assess daily notes or how it was being delivered at the time. So to capture their ideas at that point rather than just at the end of the project. There was also observation by the researchers. They also rated the different schools based on how well they adhered to the intervention, which means how well they were delivering it. Were they following the instructions properly? Were some of the schools not delivering it like they should? And that could impact the results. And by rating the schools in that way, it meant you were able to compare the schools that delivered it as it was designed to the schools that might not have done it so well and see if that had an impact on your intervention. Because what you don't want is somebody not to deliver it well and then it to impact on whether you think your project's successful or not, because they skewed the data and made it seem like it wasn't. So capturing these things as you go along is really powerful. The other thing they did within their report was they captured and reported quotes to demonstrate what teachers, parents and children thought of the intervention, the process and how effective it was. And I think quotes are a really good way, as much as we want measurement tools to capture standardised information and data and a measurable impact, these quotes and stories are really powerful. They can often give the wider context to help you interpret the data that you've got. So definitely still capture that sort of information along with the measurement tool information. Sadly, this particular intervention found that it had no effect. So they did this huge project and it didn't work. But what they did do is give possible reasons for this. So they thought that it could be down to things like there been needing to be wider support in other environments and not just at school. So as much as you can change the environment and a child's exposure to food and physical activity in that setting, that's not controlling what's happening at home and in the wider environment. But despite that not working, that's still really useful insight. And the information that they gathered as they went along and what worked well is still something that shapes future projects. So it's just really key to notice this was a project that was delivered by a university. But it's just as more important to share what doesn't work as what does work when it comes to measuring interventions, because that's what's going to shape future projects that we deliver in the city, both for yourselves with future projects that you do, but also for other people who want to learn from all the approaches taking place across the city and shaping what we do in the future. Because I think what's really key is we need to share this learning widely because all of us can benefit from what other people have learned. So that's partly what this measurement toolkit project is about. There's some additional resources here. So within these links, there's NutriTools and there's DAPA Measurement Toolkit. Within both of these is a very comprehensive list of lots and lots of different tools that might support you with measuring the impact of interventions. Some of them are more designed for academia and universities to deliver and might feel a little bit heavy, but other ones are more accessible. So the ones we've discussed in the session today are ones that we've picked out that we feel are more suited for people who might not be researchers in academia. But there's a good chance that there's going to be some other ones within these two links that might support you with finding other resources that work for you as well. So I highly recommend having a look through those, seeing what's possible. And sometimes you end up needing to create adapted versions of tools for your population group as well. So thank you very much. And I'll stop here to see if you've got any questions.